Good morning, everyone. Afternoon, I guess, in most of our areas. I'm Bernice Jordan, Public Health Program Manager for the Opioid Prevention in Tribal Communities. Let's go ahead and go to the next slide. So I just wanted to start off with this gratitude slide. I know we have been all rushing around trying to get, here to there. And if you just get a moment to just kind of remember why we have gratitude, the quality of being thankful, readiness to show appreciation for and return to kindness. Think about one thing in your life that you're grateful for in this moment. Always remember to focus on now and express gratitude in every moment of your life. Hold on to one thing you're grateful for when circumstances present themselves, and breathe in love, peace, and light. Next slide. So we're just going to give a really quick overview of these next two slides, just to show what tribal epidemiology centers where we're located at. As you can see, we're the whole right side of the eastern map. Next slide. And the vision of the TECs. I know most of you have heard this bill already before. And it's to increase awareness of public health needs in Indian country, to strengthen capacity and practice of public health in Indian country, to provide high level of response expertise on public health subject matter and methods, integrate public health practice into IHS and tribal health services. Next slide. Just going to go through the opioid umbrella project overview. I know it's a little small. It was started 2018. It commenced a 5-year tribal public health capacity building and quality improvement umbrella cooperative agreement, opioid umbrella, with the Centers for Disease Control and Prevention, the CDC. 2019 to 2020, opioid umbrella collaborates with one sub-recipient tribal nation partner. Sub-recipient completed behavioral health needs assessment and utilized the results in addressing behavioral health issues that contribute to opioid overdose. USET staff provided additional technical assistance, training, and resources. So that's when that started. 20 to 21, opioid umbrella expands their sub-recipient partnership opportunity and engages 2 additional in conjunction with the needs assessments to determine the services intervention and gaps related to opioid overdose. In addition, also the technical assistance, the training and resources as requested, provided ongoing strategic plans for intervention to address the opioid overdoses. And in addition to that, we created the ODMAP ECHO and recorded the 5 videos to show that implementation. 21-22, opioid umbrella expands their sub-recipient partnership and engaged with an additional tribal nation partner. Just the same as above, completed needs assessments to determine the services, intervention, and gaps related to the opioid overdose, and created 2 culturally appropriated health education materials. And now we are in year 5 for 22-23, and we just picked up 1 additional tribal nation partner. Next slide. So some of the previous sub-recipient projects that we have completed, this is just a small part of what some of our sub-recipients have done. There has been so much work going on within this project, within the last 5 years. Year 2 and year 3, Mashantucket Pequot portion, Mohegan, year 4, Catawba. There have been a couple of the wellness books created, which USET staff have helped create. There have been an opioid task force that, came back to rotation again because of the COVID pandemic. We piloted and started training up again on the ODMAP. We brought the Reclaiming Native Psychological Brilliance Echo Series. Some of the events that were hosted were some overdose awareness walks, River Ramble for Recovery, Mobilize Recovery, the prescription disposable events, basketball workshops, naloxone training and canoe journeys. There were some of the walks that were done. There's just so many different things that the sub-recipients have done. Next slide. So I just wanted to kind of touch base and touch on each of the tribal nations that have done some of the work for this grant, starting with Meshutucket Pequot Tribal Nation. They were one of the first, or they were the first tribal nation to do work with the grant. As you can see, the material that they presented here, Keeping Our Community Safe, that was their wellness book, included. They had put in the resources that have built or have actually bridged the gap to between all the services that were around Pequot to show what was needed there. And that was brought from the survey that we helped them create. So far with opioid education and prevention, there were multiple forums where tribal citizens were able to voice concerns and have open space to discuss issues within the community. They held educational basketball workshops for after-school programs to highlight getting active and providing prevention education. Their most recent event was Recovery Month Forum. They had a tribal citizen and recovery coach, Herb Boyd, and Professor Frederick Knowles speak on the different effects of substance abuse and that has on your life and family. Currently working on planning the next steps for social determinants of health. The partners that we work close at hand with is the Director of Tribal Health and Social Services, Shanna Reels and Shyla Barnes. So I'm going to give a shout out to them for all the hard work that they've been doing. I know the pictures are kind of small, but there is one of the basketball camp, some of the materials that they created. One of them is just the resources that they handed out, the meditation books and guides and some of the teas and things that they handed out during the COVID time. Next slide. This is Porch Band of Creek Indians. We had the opportunity to highlight them in one of our Facebook and social media sites, as you can see on the left. That was the post that we highlighted them on. USET's Tribal Health Program Support staff have been working together with the partners of the Porch Band of Creek Indians to implement activities focused on opioid prevention. Successful strategies have been helping the community self-identify services to address opioid misuse, providing guidance on support groups and education on opioids, and conducting a data flow analysis to identify ways data can be used to expand services to tribal citizens. And there is the post. Porch Band of Creek Indian successes with opioid education and prevention. So Porch Band was able to collaborate with the housing department, which hasn't happened ever. And this was the first time doing that with the law enforcement, behavioral health, and some of the other support services. The tribal community had a huge turnout. On the left, there's a picture with law enforcement. They were able to, the officers were speaking on opioids and spreading the awareness on counterfeit pills. They have had a huge overdose spike on the counterfeit pills lately. So they were able to be a part of that event. doTERRA packets, the distribution of those were given out, community wellness guides, and just, you know, some of the other things that they have done were given out. They have so many materials that they did with this grant. Other events, opioid and drug overdose walk, opioid committee, clinic expansion for prevention services, early intervention services to include drug court and support groups, mat therapy, fall festival, which was held during the Red Ribbon Week. Some of the events that are coming about are the integration specialist to bridge the gap between primary care and behavioral health, which is holistic health. Mud run for teens at Magnolia Beach in May. So we want to give a shout out to the partners, behavioral health manager Kim Snow and Taylor Smith, for helping with these prevention activities. So some of the pictures on top, they have their big End Overdose banner, their t-shirts, supporting the fighters and admiring the survivors, honoring the taking drug overdose awareness, and of course the materials that they've made. Next slide. The Mohegan Tribe. So the Mohegan Tribe successes, their recreation summer program camp for kids that led up to Cultural Week, their powwow. A lot of times what we've heard with the tribes is that there is a age group that is hard to reach. So there's always a time for coming up with ideas and helping create activities for these kids. Terry, Behavioral Health Director Terry McHale and Donna Van Sickle are our partners who lead the efforts there. Came up with a corn husk and face dolls, adapted the traditional story to apply the self-worth, emotional health, and prevention. The kids were helping make baskets. The camp included a magician. They're in the planning stages, or we're in the planning stages of a sober graduation party, which had been on hold. And soon they're talking about a Ghana event. This Ghana event, the gathering of Native Americans for families, which leads to just a lot of training for families to get together and to hold some more prevention efforts. Next slide. Catawba Nation, this is headed by Behavioral Health Director Haley Wade. They were one of the last to come on board. They have done so much within that last year. They started out with a mobile crisis unit. I know some of the pictures are really tiny. They have recently held a Who Makes Up the MDT multidisciplinary team. So they're heading up a division of Health and Human Services, Behavioral Health, Family Social Services, Juvenile Justice, Economic Development, Housing, ICWA, Indian Health Services, and some peer support in some other areas to help foster something as a whole for building that person back up. So those are in the works. We were talking the other day about how you know, it started from, you know, the beginning with the mobile crisis unit and how things have just flourished and how things are really taken off from the mobile crisis unit, and now it's becoming a multidisciplinary team effort with that look on helping people get the services that they need in a positive direction. Some of the other things that they have done in the past were the harm reduction kits, the peer support services, some of the treatment, the prevention services. Some of the events that were held were the Catawba River Ramble for Recovery, the Overdose Walk, annual sobriety banquet. And one of the events that they were able to get involved in was the Mobilized Recovery bus tour that came through the United States. And Catawba was one of the only Native American communities that were involved. They made a stop there, and they were able to showcase some of the things that they have done within Catawba. And they were actually on TV and social media. And then they headed out to, you know, up north somewhere, but they were a part of that journey. Next slide. So I'm going to go ahead and hand it over to Brian. I think I've talked enough, so we can go ahead and pass it on to somebody else to go ahead and talk about our reclaiming series. It's all yours, Brian.
Okay. I'm Brian Hendricks. I'm the quality improvement data analyst at USET. So our Reclaiming Native Psychological Brilliance Behavioral Health Echo started last year in January 25th, 2022. And throughout the year, we've had over 1,500 register for the event. The registrants have ranged from 317 to 486 per month. The actual number of attendees were 112 to 200. Post views were 57 and up to 721 as of today. So that's really great, great numbers. We've also received the National Impact Award from NIHB for Heroes in Health, which was wonderful and exciting. We've had 52 federal and state partner organizations join the call, 99 Native organizations, at least 99 Native organizations, 84 schools and universities, and 117 hospitals, health clinics, and treatment centers. And we've had all 12 of the tribal epidemiology centers represented on these calls. So our reach has been far exceeded our expectations. Am I talking about this one too?
Sure.
Okay. We collaborated with Eastern Band and Cherokee Indians, Mark Tuttle, who was their epi. He gave the ODMAP, he was the ODMAP subject matter expert for our ODMAP echoes. We held 5 of them. You can find them on YouTube on our channel. ODMAP is just a mapping software that detects overdoses. It has information from police departments, ambulatory services, and other agencies.
All right, my turn. My name is Amanda Watts. I am a public health program coordinator here at USET. And I'm going to talk a little bit about the opioid task force. So this is kind of just a broad timeline of what has happened with the task force. In the early 2010s, about 12, 13, the board of directors established a task force regarding opioids as a result of just the need and express interest in having these meetings. They were meeting over conference calls. After a little bit kind of fizzled out. So in early 2021, it was reintroduced. People were interviewed, kind of seeing what their behavioral health opioid needs were in their communities. And then we kind of developed what our vision of the task force would look like, obviously leaving that opportunity up to the members to really form it, but just kind of wanted an internal scope and somewhere a bouncing point off for the members. On May 10th of 2022, we had an interest meeting. This was just a small group of people that, wanted to learn more about the task force, what that looked like. We shared kind of our internal vision, which is we aim to be a cross-sector collaborator among health, education, justice, social service, federal and non-federal partners, USET member tribal nations, and other stakeholders to develop and promote community-based solutions to address the opioid crisis. We also talked about potential activities, who can join. We kind of, opened the floor to anyone can join, anyone who wants to be involved, anyone who wants to share, learn, just grow in their opioid crisis knowledge and skills, and how they can help their communities. And then we kind of expressed commitment levels of how we would appreciate people being able to come to meetings and interacting with us at different times throughout the year. So then June 7th, we had our official kickoff meeting, which was a little bit bigger of a crowd, and just saying, hey, this is what we are, this is what we're doing, here's a couple of thoughts. And then we introduced meeting at semi-annual. So during semi-annual, we met with Holly Echohawk, who talked about successful opioid programs throughout the country, and she works with the Opioid Response Network. So really just a valuable resource and fountain of knowledge regarding opioids. And we just opened the floor too for people to talk about problems or crises or issues going on in the communities regarding opioids. And we're just able to kind of pick Holly's brain about what that looked like, or how she could help, or how the network could help, or each other, and kind of just we asked questions about what people wanted to see in future meetings. So then October 12th, 2022, we met again an annual in person. And we talked about ODMAP. We talked with ODMAP and the HIDA. Allie Burrell, who is actually one of the people who started ODMAP and kind of created it from the beginning. She's based out of Washington, D.C., and she just really gave us a very in-depth of this is what ODMAP is, this is why it was created, this is everything that led up to the actual ODMAP being presented. And she was also able to address some of the concerns that our member tribal nations had regarding to security, safety, being able to pinpoint who the person is, things like that. And then ODMAP specifically, Mark Tuttle, was previously mentioned, he was able to show us what that looked like at EBCI, what he does on a daily basis, and then just really was able to answer that from a community level. Allie was able to give the global, a macro perspective, but Mark was really able to give that lower perspective. So then next month in February, we're going to have Tribal Wellness Court. So we have someone from the Catawba Indian Nation and someone from St. Regis Mohawk Tribe who will be presenting on their Tribal Wellness Courts, what it looks like in their community, successes, challenges they've had, why it's important to their tribal citizens, and then just kind of encouragement for other communities and what that could possibly look like in their communities. We also have on the horizon, hopefully in May, doing a data workshop, kind of looking at state and local data and helping people learn how to find it, how to work with it, how that can benefit their communities, how they can work with larger partners like the CDC, SAMHSA, local and state data networks to really help understand their own communities, but also represent themselves and make themselves known for future data purposes. Overall, we've had 9 tribal nations represented, which is about 24 people overall. We've had health, we've had behavioral health and clinical staff, tribal justice, we've had police chiefs, tribal wellness court representatives, and directors of public safety. We've also had housing represented, and then 3 national partners, IHS, HIDA, and the Opioid Response Network. And I will pass it along to Emma to talk about data flow analysis.
Thank you. So this is one of the activities we've done as part of a couple of different of our opioid projects. We know, particularly in this area, data is so important across all health areas to really understand what's going on, so you can understand, where it is you need to target resources and how you can best address the problem. But from historical knowledge, we know that tribal nations in our area have a hard time accessing data, particularly related to opioids. And a big part of that reason is that a lot of the treatment and services that these individuals are receiving are through referrals and referred out, as opposed to being carried out within tribal or IHS clinics. And so that's where this idea for a data flow analysis really came from. So the goal of the project was to understand the purchased and referred care, the PRC process, the referral process within a tribal clinic, and identify ways to improve the flow of data back to the tribal nations so they have a better understanding of what it is, what treatment their citizens are receiving, and where there may be some potential points of intervention. So we ended up doing this about a year ago now, I think, with the Porch Band of Creek Indians. We conducted 11 interviews with staff all across the health center, and these interviews really focused on the referral process itself, how patients are deemed, the eligibility process, approval and how the approval for the referral is done, billing and documentation, technology and data, infrastructure related to the referral process, and then crisis and emergency response. And so through those interviews, we were able to put together this flow chart of how information about the patient gets sent out to the referring provider and how it comes back to the tribal nation. And so we, as a result of all of these interviews, put together a report tailored specific to their tribal nation with recommendations related to where some of those bottlenecks are. And then we were able to reach out to the broader USET network, to partners we've worked with over the years who are really knowledgeable in this area, and make some connections there to help with some of that, some of those challenges. So it was a really, really great project. As you saw earlier when Bernice presented, all of the tribal nation partners working in opioid are doing such amazing things. And so to get to work with them was really great. And I will pass it on, I think, back to Bernice.
So just a few of the ways that we measure their performances. We measure by reporting back to CDC, and just there's a couple of ways. All these outcomes are really optional, but it's a good way to help them see where they're at, help us see where we're at, and of course for the CDC to gauge what's happening across tribal nations. So develop or strengthen strategic plans, number of community outreach activities delivered, number of tribal citizens, community members trained, number of public health program staff trained, and number of interventions created. Those are just a few that we have picked. Next slide. So TEC Support Available. These are just some of the ways that we can help. We have led a hand in survey design, digital storytelling, community consensus workshops, identifying data sources and data tracking, in-depth interviews, focus groups, evaluation plan development, creative tailored evaluation assistance, and community health assessments. And I think that is it, Brian. Next slide. I don't think there's any more. So at this time, do you have any other questions? The floor is open. Sorry for the monotone.
I have a question. What was the Datura packets?
The Datura packets, those are the medication breakdown of the medication breakdown packets. So if a lot of the elders or just people have so many different medications, they can use those packets and put the medications in it, and it just breaks it down in a clean, environmental way.
Okay.
So besides Datura, we have a tribal nation partner that actually has a similar product And I was just sending that information to Amanda yesterday, or talking with Amanda about it yesterday. I can't recall what it is, what they call the product, but it is a Catawba Tribal Nation citizen that actually makes something similar.
It's called RX Destroyer.
RX Destroyer. So those are some of the things that the tribal nations are interested in when, you know, on a bigger scale. Some of the pharmacies have those as well. Any other? I had a conversation the other day with somebody about some of the things that are on the market right now, and it's the a lot of the tribal nations are overdosing, and it's the a lot of the drugs are starting to look like candies and things like that. So there's a lot of information that's coming down on the websites, the drug websites and federal websites, to look for people aren't getting what they think they're getting anymore. So that's what's causing a lot of the overdoses. Any other questions? If anybody else would like to receive more information about the task force, please email Emma or Amanda. And there's also a link in the chat.
Great, thank you, Bernice, for that great presentation. Anybody have any other questions? If not, we can go ahead and adjourn. Okay, well, y'all have 30 minutes back of your day. Y'all have a
Great
rest of
job,
your day.
team. Thank you for this.
Thank you.
Thank you.
Sounds good. Thank you guys. Bye.